Okay. This one's for you, Doc.
What is it like to be a patient working with doctors when you have a serious disorder or disease or something that affects your life in a way that really is hard?
Me as a patient, I am British, as you know, and part of being British is something called the stiff upper lip, which means that even if you are having the most wretched time and you're feeling awful, your anxiety's through the roof, you want to break into a million pieces, you do not let anyone else know.
Something that I wish that my doctors knew ahead of time is that I have this huge habit of sugarcoating things.
So part of the problem I have is that I'll go into a doctor's office and I will sit down and I will be chatty, smiley and super polite because that's the way I've been brought up, and super respectful to what they have to say and what they're, the time they're giving me. So obviously that doesn't allow for them to really know what's going on or to the extent, and sometimes that means that treatments get put back or they may not even consider that my issue is that bad.
My doctor didn't have a lot of extra time, but he was pretty busy. If I were going to talk to him more, I'd let him know, I was an athlete, like a junkyard dog with a bone. I would never give up, so I want him to know that so he can prepare me for how I was, an athlete, someone who doesn't give up.
In terms of wanting you as a doctor, if you're listening, to know what's important, let me tell you what worked for me.
I suppose if we had to break it down into a couple of rules to live by, one is remember that as a physician, as a PA, as a nurse practitioner, as a nurse or any type of healthcare provider, that you hold an extraordinary amount of power when you enter an exam room with a patient. You're dealing with somebody who is injured, vulnerable, harmed in some way, because if they felt great, no offense, but they wouldn't be coming to visit you and just hang out with you, right? They're there for your help. They're trusting you to take their concerns seriously. And keep in mind that the person in your care may have had to take off of work, take a bus to see you, take multiple buses or get a family member to drive them, maybe had to turn down shift work or making money to feed their family to come see you and come get your help.
We are human beings with real emotions, and in order to treat us, you have to first treat us with compassion.
So I would say the first thing that is so important to me, and the thing that really works for me, is when I have a consultant or doctor that really truly listens to me and gives me the time to go through all of my symptoms, all of my problems, all of my pain diaries, talk to them about what is currently going on, a more holistic overview of what's going on and how it's affecting me, not just the immediate symptoms.
My neurologist, our relationship works really well because of his generosity and inclination, desire to spend lots of time with me. Gives me an enormous amount of time.
I think the two things that I like about my neurologist has been they really take their time and ask a lot of questions about how I'm doing, and I never feel rushed out of my appointments.
Get to know your patient. Get to understand what's bothering them, what's affecting them, what their wants are.
It's important that we feel heard and validated.
One of my preceptors and mentors taught me that if you just listen to your patient, they will tell you what's wrong with them, right? So it's really easy to think that, a patient's presenting in a certain way and you know exactly what's wrong with them and maybe dismiss kind of some of the outliers. But don't be that person, right? Listen to your patient, make them feel validated, and remember that you're there to help them.
One of the things that aggravates me the most is when a doctor strictly goes by the books or his teachings rather than to listen to the patient who's right there in front of him living through that disease or condition, that pain or that discomfort.
I honestly can't remember a time when a doctor or a health practitioner has diminished my condition or made me feel like it was all in my head. And I understand that, you know, most of these people have seen my MRI and they can see inside and see a picture that matches with the symptoms that I report feeling. But I can also present as very sort of normal looking and just report on the symptoms I feel, and it's nice to feel believed and validated. It's very powerful.
I think it's as simple as a physician that's willing to run tons of tests. I don't know how relevant it is that I've always been on state insurance, but it is quite a hassle. It always has been to say, I want all of the blood tests run. I want all of the information about what's going on underneath the surface. I don't just want to have a dialogue. I don't just want you to nod and prescribe me something. I want real quantitative answers about what's going on.
You know, the more people who can come at it at different angles, it's great. It feels like I have a team. And I know that's not easy for everyone, but when it can happen, it's awesome.
If it's not life-threatening or something like that, if it's not urgent, that, you know, you can take time with them, or, you know, you can even send them home with a list of options and stuff like that. And you give them time and space to think about it, and then you send them in for a follow-up appointment, and then, you know, you recollect and reconvene, and then you go from there, working together, working as a team, you know, doctor and patient.
One of the main reasons that keeps me going back to the same doctor since 1998 is that he makes sure to include myself and my wife not only in the diagnosis process, but in every part of the treatment as well. He says we're a team, and I truly believe that.
I think as a patient, if a doctor had really gone away, spent even an hour of time looking at all the information I've given them, and then came up with a treatment plan or a couple of ideas of treatment plans, came back, gave me the pros and cons of each one of those, and said to me, look, this is the one I would recommend for you based on the information, but obviously it's completely up to you. And putting the power back into the patient's hands then allows them to feel more empowered and like they're making better decisions about their health and their well-being.
It's really common in my experience that physicians expect me to just kind of hand over the reins and let them figure out what's going on, instead of involving me and explaining things to me on a deep level.
There should be a person that educates you about being a hospital. Because, you know, you go from the intensive care unit to the hospital, and there really should be someone ready to prepare you.
I have also really appreciated doctors and practitioners who lead with curiosity and humility.
Embrace the power of I don't know.
You know, if they are at a loss, they just straight up tell me. And I appreciate when that happens, instead of them trying to pretend that they know what to do next, and then just trying things that don't work.
What works is being heard. What works is a relationship between patient and doctor.
where the doctor says, yes, I will hear you. Yes, I will investigate further. Yes, I will admit when I don't have all the answers.
I have been on both sides of the exam room, and I will tell you, I would much rather hear somebody say, you know what, Brianna, I don't know what's going on with you, but I'll refer you to somebody that does. Or I'll go home and I'll look this up, and we'll partner together, because we're partners in your care, to figure out what's happening and to help you feel better, right? I can guarantee that patients would rather hear that than, no, I don't think anything's wrong with you. Have you considered that maybe you're just stressed out? Or have you considered that maybe it's your period, right? Don't be that person.
I don't like taking medicine unless it's really necessary. That's one thing that I think she would like. I think she knows that, but I don't think, like, I've never, like, personally, like, directly said that to her. Even if it's not Taurus medicine, even if I have, like, a little small headache or something like that, I really don't like taking medicine unless I really need it.
It makes me feel heard when they don't, when I'm talking to my doctor and they bring up something and I have concerns about it, and they don't force me to do all of the things that they suggest. They don't shove all their pills down my throat and, just expect me to go along with it. If I have questions about what I'm taking, which is very important to me, I like to know what I'm putting in my body. And having a doctor that, they respect that.
The other thing that I like about my neurologist is that they're open to whatever sort of things I might be into for treatment, assuming that it's not going to hurt me. For example, I do a lot of, I'm taking Western pharmaceutical drugs for my condition. And in addition to that, I try all sorts of alternative treatments as well, alternative medicine treatments as well. And my neurologists have been really open to me trying other things. They'll say, okay, there's some evidence for whatever I might be wanting to try, or there's not necessarily a lot of evidence, but that's a fairly benign treatment. So they've never been dismissive of anything I've wanted to do.
A disorder in a book is a different thing than a disorder in a person.
Well, what can medicine offer those of us that suffer without physical signs, or those like myself who have unexplained disease processes like ALS?
I think the biggest thing that always plays on my mind is that a lot of the time it's a one-size-fits-all model. So there are a lot of consultants and doctors out there that specialize in a certain area, and they don't look at patients as individuals. They look at us as one collective, and that doesn't really work.
He was always super direct, and I was kind of an anomaly, and my mom was there asking tons of, mom questions about how could a 24-year-old have a stroke, or how could this happen? Something went wrong. But he was always really straightforward with her, with me, about what I needed to do, the steps that I needed to take to get better.
No one told me your body changes when you're in the wheelchair for 10 years. I mean, you should see my stomach. You should give it a zip code.
And I never really expressed my thoughts and feelings. I never cry. I never really express my sorrow about my continuing decline of my body. I don't want a lot of time because I know I can't, but I would like to express my whole personality, my whole soul. And I don't think it's my physician's fault. It's probably my fault because I'm so trying to be the quote unquote good girl, good patient, a role that I'm used to, that I've played my whole life.
I wish that I could relay more clearly to physicians that I have or will have in the future that it's really easy for me to ignore what my body needs, and that intersection between my mental health and my chronic illness usually leaves me ignoring my symptoms and ignoring the needs and ignoring the treatment plan. It's really easy for me to put that off. And I wish that more physicians had adequate knowledge about addiction and the way that mental health plays a part in our abilities to take care of our bodies.
It seems as though a lot of the doctors I've seen they're very good about asking about how you're feeling physically, but sometimes I don't necessarily feel as though that you get as good, that they're as inquisitive about your mental health.
And acknowledging that everything is connected, that's really important too, and super helpful. And some doctors don't do that, and that's just sort of scary to me, because, you know, your brain and your gut is very connected, and when gut problems are happening, problems happen up here too. And I went years without them even like wanting to touch the mental side of all of this. But when you're living with a chronic illness, it's huge. You know, you deal with depression and anxiety because you don't know what's going to happen next. And the doctors that I have now are really good about respecting that, and they understand that I've been through a lot, and that's really important to me.
After Dr. T came back to remove the needles, we finished the treatment with a warm embrace. That was some of the most profound healing of my life. Surely standards of care should not be rewritten for all doctors to kiss their patients. That said, can we hold the vision for a medical system where that type of intimate connection is possible, even the norm?
You are the hands and feet on the front lines of people's worst days, and somehow you're expected to have all the answers. That's a heavy burden to carry, and no amount of schooling can prepare you for that responsibility.
Let us be honest. If medicine is the ocean, we understand the Puget Sound, which is not technically the ocean. We are masters of inference. What we learn in the Puget Sound, we infer how we affect the ocean. What we able to do with our medical system is remarkable, but we have not begun to grasp the essence of the ocean.
We're all in this together, and the more that we stick with what our heart is telling us, what our gut is telling us, which is, hey, patients really deserve better than what we're giving them right now. The more we do that, the more I'm confident that we really can improve healthcare for everybody. So just remember that we're in this together, and your patients, your colleagues, me, we're all grateful for what you're doing right now.